Hello. In this video, I'm going to be talking about ductal carcinoma in situ, or DCIS for short. DCIS is stage 0 breast cancer, meaning it's not invasive. I'm going to describe the difference between DCIS and invasive breast cancer, and also talk about whether or not DCIS is dangerous for you. I'll also talk about what if we don't treat DCIS, and is it possible that we're over-treating DCIS? As I mentioned, DCIS is non-invasive breast cancer. By definition, then, it can't spread to other parts of your body. However, if you've just been told that you have DCIS, we don't actually know till it's been removed if there might be some invasive cancer in there. That's why we remove DCIS in many cases. After DCIS is treated, is it possible for it to come back? Well, yes, it is. In the unlikely event that it comes back after treatment, it's important to know that some recurrent DCIS can actually be invasive cancer. If you want to learn more about treatment options for DCIS and what you can expect with treatment, take a look at our other video that goes into much more detail. As I mentioned, we don't always know if DCIS is purely non-invasive or if there may be some that's invasive cancer. So that's why we do surgery for DCIS. Is it possible we're over-treating DCIS? Yes, it is. And in fact, we're studying if there are other ways to treat ductal carcinoma in situ without surgery. Stay tuned for more information about this and talk to your doctor about this. Is DCIS dangerous? Well, anything with the word carcinoma in it, of course, makes us think it might be dangerous. But as I mentioned, DCIS cannot spread to other parts of the body. The biggest impact is on the breast itself. How we treat the disease is important. We want to make sure if you need surgery that all the ductal carcinoma in situ is removed. Again, our treatment video will go into more details about DCIS. When it comes to treating ductal carcinoma in situ, it used to be the case that women would have removal of the entire breast. Just like with invasive cancer, that's usually not necessary, although for some people it may be. Hormonal therapy is used in DCIS to decrease the risk of you getting cancer again, both invasive and non-invasive. But because your survival isn't threatened, your survival also can't be improved with hormonal therapy. So if you're not tolerating hormonal therapy, this is something to revisit, as if from the beginning with your medical team. After you've had ductal carcinoma in situ and have been treated, how do we follow you? You will have visits with your doctors, usually your surgeon, and if you have remaining breast tissue, that is, if you kept the breast, we will recommend mammography just like we do with invasive cancer. And just like with invasive cancer, we don't do any blood tests. If you are likely to carry a mutation that's responsible for, at least in part, you're getting DCIS, genetic counseling, and perhaps testing may be important. You can see our other videos regarding genetic testing, regarding follow-up after breast cancer, and even about why you should participate in a clinical trial. If this video was helpful to you, click like and subscribe so you can see other videos that might be important and helpful to you. I'm sorry you're going through this, but I know you can get through it. Take the best care of yourself.